Hi, nice to meet with you again. Today we are going to discuss a little bit broader concepts of training female soccer athletes. Namely, we are going to discuss a little bit more about competitive microcycle in relation to training load physiology in female soccer players. So we can say that first of all we will discuss a little bit about the game load. When we are considering the game load demands in female soccer, we can say that the average heart rate is somewhere about 85% of heart rate maximum, and several times during the game it can reach almost 100%, let's say 97% of heart rate maximum. And those were the studies published 10 or 15 years ago. Considering lactate concentration, we can say that average lactate concentrations reach around 5 millimoles per liters, with occasionally higher values after periods of high intensity during the game. When we relate this to male game load demands, we can say that it is almost identical game load demands comparing to male football players. So we can say some of the articles published which underline this previous slide that I just mentioned you. When we speak about the game demands, we can say that approximately, on average, female soccer athletes cover total distance of approximately 10,000 meters, 10 kilometers per game, with distinct, what is distinct is that if we are considering the higher level of female soccer athletes, they reach a higher relative load. So this is similar to male game load, and 50% of total distance is walking and jogging. And several articles stated that elite female soccer players cover somewhere approximately around 1 kilometer and 700 meters per game in high intensity, both sprinting and high intensity interval. This is significantly less, to be honest, less than elite males, which cover somewhere between 2 and 3 kilometers in high intensity distance, but more than non-elite female athletes. So we can say that higher the level, the more high intensity running. Now, some data presented considering European Championship in 2005 about total distance covered during the games. So what can we say? When we are considering the importance of physical fitness in female soccer players, we can say that elite players cover much more distance and reach higher intensity, higher game loads than non-athletes. So for example, high intensity running is somewhere approximately 2.5 kilometers, with sprinting, both sprinting and high intensity interval, around 600 meters. Numbers of sprints are 39 compared to 25 when we are considering non-athlete female players, and maximum oxygen uptake is somewhere around 57 in comparison with 45 milliliters per kilogram per minute, which are the reference values for non-elite athletes. So some other normative data for female soccer players, we can say that the vertical jump is pretty high, somewhere between 31 and 44 centimeters. They are relatively fast on sprint testing, and what is especially interesting is that strength levels, especially lower body strength, is relatively high. They can easily reach 1 to 1.5 body weight squatting abilities. So we can see some normative data, but I just presented the basic data in previous slide. So in addition, we can say that the total distance run in high intensity interval is less in the last 15 or 30 minutes than in previous part of the game. So fatigue as in males game, fatigue in female soccer games play important part. So generally we can conclude that total distances are high, total high intensity metric is high, fatigue occurs at the end of the game or on the last third of the game, and as the consequence the load during match is significant, so physical fitness is very important determinant of success in women's football. So if it's true, and we know it's true, then we can discuss a little bit how microcycle of competitive microcycle could be structured. We know generally that there is more than one way to skin a cat, of course, but generally when we are considering game loads and some specificity of female athletes' body, we can recommend some specific general overall microcycle based on physiological requirements. And this microcycle could be is presented on this slide and could be one of the best option. And if you look carefully, we can say that on Monday after the game we have a day off. So Monday would be technical, tactical training session. Tuesday is a strength training plus high intensity aerobic training. It's very interesting. On Wednesday we have a day off or some recovery training session. Thursday, if there is going to be 2 training sessions or 1 training session, it doesn't make much difference. We have again strength training for female, recommended for female athletes, with some technical tactical aspects of the game. And Friday is a technical tactical aspect of the game, and Saturday we have a game. So what is interesting here in this presented one presented possibility for microcycle, competitive microcycle for female athletes, is that 2 strength training sessions are recommended. And another interesting point is that high intensity aerobic training is put 96 hours before the game, which is not usually recommended for the male athletes. And after this very high intensity Tuesday training session or 2 training session, it is recommended to have, for female athletes, to have a day off, or at least to have some recovery training sessions. Why this is interesting? The force is king, as you know, and the force for male, the absolute strength or strength development is very important, of course. But for females it seems to be even more important. Why is it important? It seems that for female athletes, force development or strength development has ultimate importance for the injury prevention. We know that they have a 5-fold increased injury risk in comparison with males, but ACL injuries, for example, but all other injuries also. And key preventive elements for injury prevention are the strength and the knee stability during landing, so technique of knee stability, but also absolute strength, as we will see in slides to come. So what is interesting here is to underline that it seems that for female athlete, especially in soccer, strength training is recommended 2 times per week. So what can we do? What to do? There are some general guidelines that we should train female players in motor skills. We should train them to be able to fall, jump, change of direction of movement. The way the woman land is different. We don't know exactly why, but we should train technique of these landing abilities or changing of direction speed abilities. And we should also train with low level plyometric intensity and increase the power level after all. So one very interesting fact about female athletes is that we should always strive to increase the hamstring activation and hamstring strength, and this is well adapted to this microdosing planning throughout the weekly cycle. So for female athletes, hamstring activation or hamstring strength increasement seems to be one of the crucial aspects of general fitness development. So if we are considering strength, we can say that for female athletes especially, it is mostly directly related to prevention, and we should underline some specific muscle groups, gluteus maximus in particular, hamstrings, quads and core stabilizers. We will discuss this in one of the future lectures. And basic exercises that which should include should be lunges, single leg Romanian deadlifts, half squats. Squat is ultimate drill, but when mastered appropriately. And also we can use Russian hamstring or Nordic reverse or Nordic hamstring drills and all sorts of planks to increase the core stability in itself. So if we see some general strength guidelines or example for strength training, we can say that women athletes should train with relatively high intensity, somewhere around 80% of one repetition maximum, and the absolute strength is of very high importance, for one more reason per se. During the landing phases, and the landing phase is the most crucial aspect of injury prevention. It is the part of movement pattern that is mostly related to injury in female athletes. During this short landing phase, the overall force reach up to 5 times body weight. So the absolute strength of female athletes is very important, particularly in this specific phase of movement, which means the first phase of landing ability. So if female athletes have low strength level, they will have a wrong landing mechanics, and much more, they will reach fatigue earlier during the game, so the poor landing mechanics will become evident much earlier during the game, and per se will increase the injury risk. So the single best injury predictor in females is a poor landing mechanics that is related to lack of absolute strength and the lack of proper technique. If we put it in another way, so absolute strength and high quality landing mechanics are the crucial aspects of injury prevention for female athletes. And this absolute strength training regimen should be provided regularly during the microcycles. And as we can see in this slide, it should consist of very high load, so intensity should be somewhere around 90–95% of one repetition maximum. Explosive strength is of course very important and should be gradually introduced in weekly cycle, and this also with agility drills included. So during the agility there is one specificity. We should accentuate it, squat position when changing direction. And this could be easily obtained with one simple cue: touch the floor when you change direction. So this is very important aspect of changing of direction mechanics and good technique during change of direction. So when we are considering high intensity aerobic training, we stated in one of the previous slides that for female athletes it seems that high intensity aerobic training should be 96 hours before the game, so we should do it earlier in the weekly microcycle in comparison to male. Why this is happening? Because generally female athletes possess a lower level of aerobic capacity, and they need bigger recovery time, longer recovery time to reach the supercompensation. So it seems that if they play Saturday, the Tuesday is the best option for high intensity aerobic training, and intensity is the same as with men. So we can use Bilat or Tabata training session or Hof and Helgerud interval training session, but the intensities are exactly the same like for male athletes. So considering other fitness attributes, we can say that speed and agility training session should be microdosed in Tuesday and Thursday most likely, and coordination should be microdosed on a daily basis, most likely during the warm-up procedures. As we just stated, coordination is very important for landing mechanics. So generally this would be the main part of our today lecture. So we presented one most favorable competitive microcycle when we consider physiological specificity of female athletes and game load demands. But we can say a few other sentences considering diet for female soccer players. Most of the research underline one main issue: low carbohydrate intake, that is mostly seen throughout the studies, and it is related to aesthetic reasons. You know, female athletes, they tend to have a low carbohydrate intake because of aesthetics of their body. But that seems to be a very big problem in top-level athletes, and it is a good rationale to educate them that good carbohydrate intake is very important for their overall performance and health also. And there is a general guidelines with which most of all female athletes should conduct, and this is to whatever you do, you should have overall total calorie intake consisted of 60% of carbs, 20% of proteins, and 20% of fats. Finally, there are a few interesting specificities of female athletes. One is iron deficiency. In one excellent study conducted prior to Female World Cup, it was found that almost 60% of female soccer players have iron deficiency, and 30% of them came to World Cup with anemia because of their biological specificities. So there is a general recommendation not just to watch hemoglobin level in blood, but also some ferritin and transferrin levels that are going to tell us something about possible subclinical anemia and how to prevent it if we see that this is happening. And also the education of female athletes is very important about the food intake rich in iron and absorption inhibitors. The second important aspect is a calcium deficiency that is regularly seen in female athletes, and this is also because of the hormonal specificities of female athletes. And there is a general guidelines that female athletes, especially soccer female athletes, should pay special attention when considering food rich in calcium intake. So calcium deficiency is potentially dangerous for bone health, but not just for bone health. And the solution is to intake of low-fat milk products: yogurt, kefir, milk, sour milk, ice cream, cheese, etc., etc. So to conclude, there are some specific recommendations when we are considering competitive weekly microcycle for female athletes. Strength training is a must. High intensity aerobic training should be done a little bit earlier than it is recommended for male athletes. And there are some specific guidelines considering diet for female athletes. Thank you very much. Hope you will enjoy this lecture.